Yes.
All right. Good afternoon. I should go ahead. Okay. Good afternoon, everybody. My name is Dr. Kayode Ogunleye. I'm the co-founder of healthXP, the signature collaborative digital healthcare platform. And I'll be looking at the topic enhancing healthcare equity through unified collaboration platforms. So, all right. So, I want to first, this is more of a thank you to those behind this project. This platform for discussion. There have been some very robust discussions that have been going on so far. I find them very educative. I've learned a lot of things being here. I believe the organizers of this program have started something that will, I'm sure, is going to start some form of revolution across Africa. We should have more forums like this. Maybe we should even broaden the scope and have an African summit in terms of this. This is a very, very laudable initiative. Okay, let me jump into what I'm doing. I just want to first place something here, a question. Health equity. The term health equity has been used severally across different spheres by policy managers, healthcare professionals, different things. What is health equity? Health equity is different for different people, but it means one fundamental thing. Health equity means a different thing to the NHS provider in the UK, up to the ecosystem in terms of Medicare in the US, or to our policy managers here in Nigeria, or like the Federal Ministry of Health, or locally, the Lagos State Health Service Commission. Health equity is addressing this disparity in terms of healthcare access itself. That is making sure the last mile clients, as we refer to in tech, get access to healthcare. Across the continent itself, we have 70% of the population cannot access healthcare itself. 70%, that's a very big number. When we are talking of 1.4 billion people, 70% of healthcare of individuals or persons cannot access quality healthcare itself. So, what is a collaborative platform like healthXP? Let me just describe the company that it has itself. We're talking about, it has communication, that is the interface to which you speak to different innovators, the end user, the healthcare professionals, everything that are involved in the ecosystem. Easy, accessible language in which people can talk to you, can use that digital space to access healthcare itself. Then we also have, in terms of interdisciplinary collaboration between specialists, from the doctor to the physiotherapists, all in this one space. So collaboration across board. Then cutting edge technology. We've been hearing different speakers talking about the technology is not with the times, technology doesn't work. We have to, I heard one of the speakers on the panel complain about the technology not even up to terms in terms of how the doctor diagnoses or assesses the patient in terms of, you want to listen to the heartbeats, the pulse rates, and all that. Technology has to be cutting edge technology that is up to date. AI, every new advancement, that's what a collaborative platform should have. Then EMR system, and this means a lot for different people. That's electronic health records. For the healthcare provider, it's different. He wants to work seamlessly, keep records. To the patient or the client, it's different. Access to his own data himself, which seems to be shredded in secrecy most times for the healthcare, that's the end user itself. Then holistically 360 approach in which that platform can collaborate all this information and make sure these things work itself. Okay, so I don't know if my slides are moving. Let's see. All right. Okay. Let me continue. Like I've explained, slide 2. Okay. Bridging. Well, like I've described what the platform is all about itself. I'm moving in which I'm trying to explain Sorry. All right. I'm trying to explain what the ecosystem, a collaborative platform should offer itself, and healthXP being the standard template in that regard. You should have a space in which you have different specialties, pharmacy, EMR, the emergency response provider. You should have a ways of dispensing the technology for itself to work. All those things have to work in the ecosystem itself. In that way, the framework works. That's the bedrock of that framework should have all these things existing in the collaborative space. I'm answering that question that I pondered at the point. A collaborative platform is supposed to address and bridge that disparity in terms of healthcare provision. So, because what we have presently, we have situations in which healthcare access is more concentrated in the urban areas compared to the rural areas. The technology is supposed to bridge that digital divide we're having. Africa itself or Nigeria on its own cannot afford to miss the fourth revolution that is happening in terms of digital technology. We've missed it in the industrial revolution. We've missed it in different spheres of life. Even the nuclear age, we are still catching up. We don't have a man on the moon. But in terms of healthcare, what is happening in the last 12 months is cutting edge. It's changing everything. And healthXP is trying to be at the forefront of it. And we also encourage fellow collaborators in this journey of healthcare delivery itself. So, like I want to point out something. There's a mention about the public institutions should be at the forefront of formulating policy in terms of digital technology to be deployed to the healthcare sector itself. In my own opinion, I feel this has to be spearheaded by the private sector. The notable example is what DeepMind, Google's DeepMind, is doing with the NHIS. They have a 5 years revolving contract. They are doing research, cutting-edge technology that's helping them plan the system and the structure itself in terms of how data is being employed to solve the country's problem. That is not done in-house. You can't be the judge and the arbitrator in your case. This technology and these solutions have to be outsourced. So I believe a handshake across between the private sector and the public sector is very important. Another notable example is what Epic is doing with Microsoft, if I'm correct, in terms of EMR technology. They are adopting, there are many things happening. And our own providers, we want to be there, and we encourage all collaborations across board in this wise too. Okay, so what are the benefits? Like I explained already, the disparities, a collaborative platform would address the disparities we have in this system itself. So this is what from the slide itself, we're doing more showing what a unified platform should have itself, instead of the efficiency. I explained that already. Interdisciplinary collaboration, shared health records, which is suspect, where people are, in terms of data, we have problems with sharing data and information itself in that regard. Okay, so what are the benefits? Let's go for the benefits for the undeserved population in terms of the benefits. Access to specialized care, access to all arrays of care. You can speak with a guy in Michigan, a doctor in Michigan. You can the end user in Nigeria can speak with the doctor in Michigan, and this accessibility also helps the problem of brain drain that is being encountered by our country or Africa as a continent itself. The accessibility, holistic approach to care, there's more of collaboration between different providers of having to solve problems of the client itself, which is the patient. Then you truly timely intervention, and the patient is carried along. Like I always say, where you have the patient being part of the therapy itself, things work perfectly. He understands why I'm using this medication. He understands why this doctor has said this is happening. It makes them understand. Information flows seamlessly. A collaborative platform helps in this wise. All right, all systems have challenges. In this wise, the challenges itself, it's very notable itself. Different speakers have spoken to the topic of internet penetration, electricity, infrastructural problems we have in the country. All these are the background itself that help that tend to affect a collaborative platform itself. But the digital divide, I believe, in terms of digital divide, internet penetration is happening well in Nigeria now. We're seeing more people understanding how to use systems and understanding what telemedicine or digital health can offer itself. I want to use a notable example, and it's one thing we always tend to take for granted: digital literacy itself. We once had on our platform a client that was somewhere in South Nigeria who had a neurological problem, and we managed to connect him with a healthcare provider somewhere in Lagos itself, a professor of medicine, neurology. So, but we had the challenge of having to guide the client to using the technology itself so they could communicate. That's where the role of the healthcare worker came into existence. We had to train and provide the tool to the healthcare worker so he could be able to guide the client along this. So digital literacy should not be underrated, especially when you're dealing with the last mile client itself. You have to find a way to make the tools are available to people that can help that community itself in that regard. Also, data security. We're in a world in which data has become something of a key that is important to planning and infrastructure. And a collaborative health platform must have very up-to-date data security that can, even because we are in the ages of hackers and everything, we can know what is happening in terms of security in the Ireland itself, in which we had a breach that became a national problem. healthXP, we try to be at the forefront of trying to make this happen, and I'm sure similar collaborative platforms are working in this regard. In our own space, we've been working along with partners like Microsoft in trying to make sure that our data is secure, and we're trying to obey, and there are also challenges obeying the different local laws from the GDPR, the HIPP, and different things. But these things are very important. These are the considerations you should have when you're dealing in terms of data security itself. Then provider adoption. Very important itself.
Sorry, Dr. Kayode, we just want you to quickly round up because of the timing, so that at least we know the time cannot be enough. Thank you so much, sir.
Yeah. So provider adoption is very important. Adoption is a problem we have in the tech space itself. Collaborators across board should be able to adopt their products and everything works standardly. All right, rounding up, I just want to paint this scenario. Just look at this scenario itself. You have a child in a northern village that has some health challenges, and you have a health extension workers that have been equipped with the tools to take care of this problem itself. He has access to a pediatrician in Seattle who has helped in diagnosing the problem. You also contact a fellow colleague who's a neurologist, and there are reports being exchanged and notes, and the health extension worker, with the aid of neurologists, let me use the word neurologist in terms of facial recognition technology, vital signs are taken, everything is done, and the diagnosis is established. And a drone operator is being summoned, and medication and samples are taken. I see that future in which collaboration platforms can enact this scenario in which I just described. Thank you very much. Sorry I didn't have more time to expatiate, but I'm happy for this opportunity. Thank you very much.
Really, opened a lot of our mind into this great technology that you have, particularly the solution that you have is really an encouraging one, and I believe that a lot of people from different parts of Nigeria are listening to this. They are watching and they are learning a lot from you, and I'm very sure there's going to be a lot of collaboration very soon. Thank you so much, Dr. Kayode, for your time again, and I really appreciate you for your wonderful presentation. Thank you, sir. And if questions comes around, definitely the organizer will send it across to you for you to respond to it. Thank you very much, sir. Have a great day. Thank you.